Welcome to another episode of Homage Web Series, and today we'll be talking about wound care and pressure sore. And for that, we are very glad to have Dr. Chua with us today. Dr. Chua is a doctor in Penang General Hospital, and he graduated from Ames University. He has a certificate in clinical wound care, and he's currently with Homage as a medical wound care partner. Let's go ahead to this episode and see what he has to say. Thanks for joining today's Homage Web Series. And today we're going to talk about wound care and pressure sore. Dr. Chua, can you just share with us what is pressure sore or bed sore as the layman term?
Yeah, pressure injury, actually what we know as bed sore, is a wound caused by pressure, shearing forces, and also friction. So as I mentioned earlier, it's a wound caused by pressure. So it usually happens on the skin that are constantly under pressure. And those areas are usually over the bony prominences. And then the pressure that I mentioned can come from as simple as lying on the bed, sitting in the wheelchair, or wearing medical device for a long period, because all those are actually creating pressures to the skin.
Okay, so will this be for everyone, or is it for patients with a slightly heavier body weight?
Actually, the risk factor for pressure injury, or what we call bed sores, are those patients with limited mobility or immobility. So commonly are those post-stroke patients, patients with spinal cord injuries, which has reduced sensation towards pain or pressures, the elderly, where their skin is actually aging and is more prone to injury. And then the other categories are those with poor nutritional status and those with poor incontinence management. And then those with chronic systemic illness like your heart disease, your diabetic, and also hypertension, also prone to getting this pressure injury because of their poor circulations.
Okay, so it happens more often in like stroke patients where they are just bed bound and they cannot
Yep.
move, so they are just in a static position on the bed lying
Yeah.
down.
Yeah.
Okay.
Yeah.
Is there like different stages of the wound on the
Yeah.
severity?
For us, there are a few stages of the pressure injury, but that one is a bit difficult to explain. But every stage we will manage accordingly. They have different management and also treatment.
Okay, so just now you mentioned that it comes from lying down on the bed or sitting down on a wheelchair for a very long time, and also wearing
Yep.
medical devices. So what
Yep.
sort of medical devices?
The most common one is nasal prong. Like after you're wearing nasal prong for a long period of time, and then there's no protective dressings just above your skin, below the nasal prong, it could cause some pressure injuries also. Sometimes I think we have one patient also, the CBD, the urinary catheter, prolonged usage, and then they tie it next to the thigh. So they just tape it. So prolonged period of taping, they will cause pressure injuries over there. So these are all medical devices related pressure injury.
I see. Okay, so it's not just. I think the common understanding is that bed sore is just on the sacral area or somewhere near
Yep.
the bottom, but it's also on things that are pressing against you.
Yep.
I see. Not just
Yep.
the body
For a
pressing
long period
against.
of time.
I see. Okay. So you mentioned just now, usually stroke patients are more prone to get pressure
Yep.
sore because they're lying down always,
Yep.
or even for seniors because their skin is generally thinner and more
Yep.
fragile.
Yep.
Poor nutrition. Is there any like
For those
common? Yeah.
malnourished patient, I would say, like inadequate protein intake patient. That's why we also encourage those at risk of pressure injury. We will encourage them to take high calorie and also high protein diet for the
Okay.
cells to regenerate faster and for the wound to heal faster.
Okay. And then poor incontinence management is also a risk factor for.
Yep. Especially like your spinal cord injury patient and also your stroke patient. Some stroke patient would involve the bladder or bowel. So when the wound, when the skin is constantly soaked in those urine or feces, it become macerated.
I see. Okay.
Then maceration, sooner or later, that you develop an ulcer, and then it will progressively worsen.
Okay. So that how it, and then you also mentioned chronic diseases like heart disease or diabetes. Is this affected by the disease itself or like a side effect?
Because as you know, diabetes also causes poor circulation, hypertension itself also, and also those with heart disease. So basically, poor circulation to any wound that would delay healing.
Okay.
You can see your diabetic foot ulcer as well. Because of poor circulation as one of the factors, the wound in diabetic foot ulcer sometimes it would be quite difficult to heal.
I see. Okay. So where are the common places or sites of injury for pressure sore?
So as I told earlier, the common sites are those skin area that is constantly under high pressure. So those skin are usually overlying those bony prominences. So
Okay.
uh, as the most common one just now you already said the lower back or buttocks because the sacrum is underlying the basically the skin overlying the sacrum is something like highest pressure is over there. That's why the highest risk of getting pressure ulcer is there. And then some we could get over the back of the head. Another common one would be over the heel, and some we could get also over the shoulder blades. But for medical devices related pressure injury, it could be anywhere depending where you apply the medical devices.
I see. Okay. What about hip or inner knees? Is this a common site?
Yeah, depending. Like let's say when you turn patient 2 hourly, when you turn patient left laterally, you keep patient there for prolonged period of time, you could develop ulcer over the hip region also. That's why when you turn patient, every 2 hourly you have to turn, and then it's best to apply a pillow in between the knees because knees to knees they can cause pressure injuries also for a long period of time.
Okay. So okay, I think we'll talk about how we can prevent pressure sore
Yeah,
later on, right? So now we know that where is the common sites of injury.
yeah.
How does a doctor or even a nurse treat injuries like this?
So basically, the treatment of pressure injury is based on the size, and then the stages. As I told you, the stages is depending on the thickness of the ulcers, whether the ulcers involve the subacute, the muscles, the bones, and so and so. But the whole principle is almost the same. Basically, you have to remove all the dead tissue, and then you have to clean the wound, and then you prepare the wound bed, and then appropriate dressings, regular follow up, and if the pressure injuries are infected, we have to treat with antibiotics as well. But for pressure injury, as I said earlier, prevention is definitely the key. We have some pressure injury prevention care bundle specifically for post-stroke patient or those patients who are immobile. So basically, that includes daily skin assessment, especially area of the pressure points. We have to check whether is there any redness, discoloration, any small ulcers that we might miss out, any pain, because pain usually means there's pressure. The skin is at risk already. And then by preventing, we means also incontinence management and also skin care. We have a principle to keep the skin clean and dry. So we have to clean the skin immediately after every incontinence as fast as possible. But and then by cleaning, we means using a gentle skin cleanser. And then after cleaning, we apply barrier products. A lot of barrier products in the market, but you can just use the simple one as Kevlon. Actually, barrier products just prevent the skin in contact with moisture for too long and then causing maceration and so. And
I
then,
see.
other than that, Ripper mattress. Ripper mattress is what we use to support the skin surfaces to reduce the pressure or even out the pressures so that the pressures over the bony prominences could be spread out or reduced a bit.
Okay.
And then another would be repositioning. So keep your patient moving. Basically, those patients who is bedbound, turn them as often as possible. 2 hourly would be best. 2 hourly turning. So every turn after 2 hours, you turn again. Don't keep patient in left lateral position or right lateral or supine. And then those patients who can ambulate, you encourage them to keep moving all the time. Because when you sit too long in the wheelchair, as I told you, you could develop pressure also. So the last one, you can also always check the medical devices and then regularly change you have to change the medical device like reposition them regularly. Don't just keep at the same place because like prolonged period of time, pressure injury will come. And then sometimes you can also provide a dressings below the medical device. Like let's say you attach your nasal prong, you can put a gauze here or some foam dressing here to prevent the nasal prong in contact with the skin and then prolonged pressure and so pressure injury comes.
Okay, thanks, doctor. So it's sort of like to cushion the impact of any equipment, and also having the proper equipment and positioning is very important. Okay.
Position basically is repositioning. Also, you protect the skin. You have to protect the skin to prevent pressure injury to occur, because once pressure injury occurs, when the wound is very bad, it takes a long time to heal.
Yeah, like you mentioned, prevention better than cure, of course. Okay, so thanks for sharing some of the treatment methods. I mean, I think even the family members themselves can do it. Not necessarily a medical expert would need to always go in and have it done. So there's also a common conception. Does alcohol clean and disinfect wounds the best?
Not really, because alcohol, as we know, is a very strong disinfectant. But at the same time, it destroys the bacteria, viruses, so and so. But at the same time, it also destroy the viable tissue and granulation tissues in the wound. So it would actually delay the wound healing. So from our side, actually for cleaning a non-infected wound, you can use a normal saline. You can get in any pharmacies, I think. Normal saline, we would recommend because it's most physiological to your bloods or body's fluid. Or you could also use a distilled water, clean water. And then for cleaning of an infected or dirty wound, we can always go for a more balanced antiseptic solutions like your dermacin, your hydrocin, your chlorhexidine, the diluted one. You can get all those cleaning solutions in pharmacies also. And then some of these solutions like your dermacin, hydrocin, sometimes they promote wound healing as well. So better not to use alcohol.
Okay. But of course, it will be then best, to always have the doctor consultation and then follow the advice, because like you mentioned, every wound is specific to each patient, right? So there is no one specific solution. Okay. And then there's another one. Does seawater support wound healing process?
About this, till now there's no documented study stating that seawater speeds up wound healing. Because from what I know is like seawater, apart from containing salt, actually there's risk of seawater containing some bacteria, some viruses also. And then this would actually give rise to wound infection. And then as we know, when the wound is infected, then the wound healing is definitely delayed. Because you have to treat the infection, so and so, and it will further delay the wound healing.
Okay, so again, back to having follow what is the medical advice provided by the doctor or wound doctor. Okay, and then another one is, do wounds heal better when they are exposed to air? Cause I don't know, maybe it's like a air circulation kind of thing to air the wound.
I know this is a common teaching, common belief by the public, but actually no . Because wound left in the air to dry, actually it form a scab. So the scab actually prevent the formation of new skin tissue, and then it also prevent the wound to close up. So it's actually delaying the wound healing. Everyone see the scab is forming, that means the wound is healing. Actually it's not . And then actually the wound require moist environment to heal. And then the moist wound actually heal faster, at least 50% faster than the dry wound.
50%.
And so because of that, the wound dressings in the market actually works to provide a optimally moist environment to speed up the healing process. But too wet a wound, when the wound is too wet, it will also cause maceration and so delay wound healing. So it's a moist environment, I would say. It's not a wet or dry environment.
Okay, so that there are how do I say, physical and environmental factors which may also help the wound to heal or make it longer. And it's very important to
Yeah.
okay. What would be the long-term effects of untreated pressure sore?
So when the ulcers involve to the bone or near the bone, it will cause bone infection. Then that one you need a prolonged duration of antibiotic treatment, so and so. It will be very tedious, basically. So your patient could goes into sepsis or what we call bacteremia. Basically, your patient is infected already. That's the thing we are afraid of when you don't treat the sacral sore properly. So the infection might ascend from your wound to your bone or to your blood, and then patient may die from it or what.
Okay, so what would your advice be for families with maybe a senior at home and who are mostly bound to bed or wheelchair, and then they've developed a pressure sore. So what would be your advice for them? Is it to seek immediate medical attention, or is it something that they can do at home first to get make it better?
If patient there's no wound, and then it's just a new patient, post-stroke patient or what, maybe the family member could help by just applying a barrier products and then keep patient moving. Reposition your family members. So family support is actually very important as well. If you can't spend the time repositioning your family members, maybe you could see some nursing services like Homage IC. And then if patient have some wound, then it's better to seek a treatment from a doctor, and then then the doctor will tell you what dressings, what treatment to use, and then you adhere to it before the wound get worsened.
Okay.
Don't just use alcohol to clean it and so because it would worsen it.
Yeah, I think everyone, because of COVID, everyone has like alcohol disinfectant at home, and
Yeah.
maybe it's becoming more and more
Yeah.
common. Okay, thank you so much, Dr. Chua, for your time, for explaining to us what exactly pressure sore is, and actually it's quite a common occurrence, actually especially among geriatric patients who are especially bed bound. So thank you. We hope you have a better understanding of how we can prevent and then treat
Sure.
pressure sore. So thank you, Dr. Chua.